Hello everyone. Today we'll be discussing about your first semester subject, that is your BVDP 103. Okay, and in this particular lecture we will be talking about we will focus only on the unit one. Okay, and there will be a separate session for the unit two, three, and other units. Okay, so in this lecture we'll be discussing about the functions of the kidney, the diseases which are linked to the kidney, and introduction to the chronic kidney. This will take introduction to the chronic kidney diseases. So what are kidneys and how they what are their basic functions. So kidneys are bean shaped organs. They are of bean shaped organs located at the posterior wall of the abdomen. Okay, and the dimension, if we talk about the dimension, the length, the width, and the thickness of the kidney, then the length of the kidney is 11 centimeter. And when I'm talking about length, it means I'm talking about from the superior pole to this inferior pole. Okay, so the dimension of the kidney, the length of the kidney is 11 centimeter, the width of the kidney is 6 centimeter, and the thickness is 3 centimeter. And the weight of the kidney is approximately 160 gram. Okay, and the kidneys are, they are retroperitoneal organs. They are located in the peritoneum, okay, on the posterior wall of the abdomen. Okay, so see this picture. This is the more, this is the actual kidney, and this is the diagram of the kidney, the computerized diagram of the kidney. Okay, so this is the renal cortex. This area is known as the cortex. This outer area is the cortex. Okay, and this inner part is the medulla, and inside the medulla there are pyramids. These are the pyramids. Okay, and they are triangular in shape. Okay, so we can relate this diagram with this one. Okay, so this is the renal cortex. This is the pyramid of renal medulla. Okay, and okay. And these are the major calyxes. Okay, renal column. This is the renal artery, and this is the renal vein. These two are the arteries. These two blood vessels. Sorry, these two blood vessels are going to supply the kidney. Okay, and this is known as the renal sinus. Okay, and renal pelvis. From here, the collected the urine, or you can say the filtered form of the blood is going to be collected, and it will be drained inside the urinary bladder. Okay, with the help of this ureter. So this is just a gross diagram of the kidneys. Okay, so the kidneys are made up of functioning units known as the nephron, and nephrons is going to have tubules and the glomerulus. Okay, so the nephron is made up of the glomerulus, the PCT, DCT, Henle's loop, and the collecting duct. See this picture, it will be more clear what I am saying. So glomerulus, or this is the glomerulus. Okay, this cup-like structure, and here the blood vessels are tangled with each other. It's just like a web. Okay, and this is the Bowman capsule, and this is the PCT, the first part of the your nephron. Okay, so this is the proximal convoluted tubule. This is the loop of Henle, and this is the DCT, or the distal convoluted tubule, and this part is known as the collecting duct. Okay, after that, okay. So, what are the this is the different parts of the nephron. Okay, the proximal tubule, the loop of Henle, and there will be ascending limb of loop of Henle, and there will be a descending limb of loop of Henle. Okay, thick limb of loop of Henle, and the thin loop of Henle. Okay, and this is the distal convoluted tubule, and this is the collecting duct. So, what are the functions of the kidney? The function of the kidney, we know that it is going to have some homeostatic function. It is going to play excretory function. Okay, it is going to have it will secrete the erythropoietin. Okay, so the removal of waste and excessive water from our body, this is the main function of the primary function of the kidney. Okay, see this picture. In this picture, the Bowman capsule, this is the Bowman capsule, and this is the glomerulus, from where the afferent and efferent arterioles are entering and exiting this Bowman's capsule. Okay, and this is the first part, that is your PCT, or proximal convoluted tubule. That this is the loop of Henle, and this is the DCT, or distal tubule, and this is the collecting duct. Okay, so this collecting duct is going to collect all the filtered content, and that content will be drained directly inside the urinary bladder, and that inside the urinary bladder the content will be stored for a temporary time being, and after that the the maturation process, the urinary bladder will be emptied. Okay, so the normal kidney releases several hormones, and the two major hormones are the renin and erythropoietin. Okay, we know that erythropoietin stimulates the production of RBCs from the red bone marrow, or the your red for the production of red blood cell. So erythropoietin will come and is going to act on the bones. Okay, basically on the long bones. okay, because long bones is going to have lots of bone marrow, so it will stimulate the bone marrow to secrete or to synthesize more and more or to produce more and more RBC. Okay, then the kidneys also secrete the renin, and renin regulates the blood pressure, okay, by renin angiotensin aldosterone system. Activated form of vitamin D maintain the normal bone structure. So these are the functions of the basic functions of the kidneys. So kidney failure or end stage renal diseases is going to have lots of complications. Okay, if there will be kidney failure, there will be, if the stage of the kidney failure is the end stage, then the complications will be more and more. So the kidney failure occurs when the kidneys do not function their do not function their activities properly, okay, or the kidney is not able to perform its function in a sufficient amount, okay, so resulting in the accumulation of waste products and toxic material. So what will happen if kidneys will not work normally, if kidneys will not work sufficiently, then what will happen? The waste metabolites, the fluid, the excessive fluid and other metabolic waste is going to accumulate inside our body, okay, and that may cause permanent and irreversible damage to the body cells, tissues and organs, okay, and kidneys that function less than 20% of required capacity, that needs a renal replacement therapy, means that needs hemodialysis or peritoneal dialysis or the transplantation, okay. So what are the risk factors related to the kidney diseases? Chronic diseases, okay, inflammatory diseases, blockage of urinary collecting system, chronic infections, and rare genetic disorders. So what are the symptoms of these diseases? It is decreased urination, the blood in the urine, okay, nausea and vomiting, swollen hands and the ankles, puffiness around the eyes, sleep disturbances, itching, the high BP, and loss of appetite are the some symptoms for the kidney diseases. Okay, so how this treatment of kidney failure can be done? Blood creatinine rises. If the blood creatinine level is rising to 900 micromole per liter, then the dialysis is recommended and transplantation will be a better option. Okay. So, what is hemodialysis? How that can be done in case of renal failure? So, a process by which excessive waste products and water are removed from the blood. So, basically, in hemodialysis, what happened? There is an artificial system in which artificial extracorporeal system. So, in that system, the patient blood is going to rotate, okay, circulate basically, and the blood will circulate in the extracorporeal circuit of the machine, okay, and it will be filtered with the help of a dialyzer, okay, and the filtered blood or the purified form of blood is going to send back to the patient's body, and the toxic material and other metabolic waste will be removed with the help of dialysis. Okay, so this hemodialysis requires access. Either there should be a AV graft or AV fistula, or the other kind of accesses are required. Okay, so this is just a diagram. This is here just to show you how it looks like, how the AV fistula and AV graft looks like. So AV fistula is going to be looking like this. So what happened in AV fistula? The renal artery, or sorry, the artery of the hand will be connected to the vein. Okay, so basically artery and vein will be anastomosed with each other, so that more and more pressure can be developed inside that particular blood vessel for the hemodialysis procedure. And in AV graft, what we can say, material will be inserted to connect the artery and the vein. Okay, so these are two are the important accesses that will be required for the hemodialysis. Then, in case of renal failure, peritoneal dialysis can also be done. Okay, so for that, dialysis solution flow into the peritoneal abdominal cavity through through a catheter, and peritoneum acts as a filter here. Okay, and okay, so yeah. So the next modality for renal failure is kidney transplant. Either hemodialysis, peritoneal dialysis, or kidney transplantation can be done for as a treatment or as a renal replacement therapy for the kidney failure patients. Okay. So what are the different kind of kidney diseases that are the common kidney diseases which can be experienced by the population? So if we talk about the stages of CKD, so the if the GFR is greater than 90 ml per minute, it means the GFR is normal or increased GFR with other evidence of kidney damage. But if GFR is in between 60 to 89 ml per minute, it means the slight decrease in GFR with other evidence of kidney damage might be there. Okay, so you can call it stage 1 or stage 2 kidney disease. Okay, and in stage 3, 3A, stage 3 has been divided into 3A and 3B. Okay, if you talk about the stage 3A, then in stage 3A the GFR decreases up to 45 to 59 ml per minute. Okay, and in 3B the GFR decreases up to 30 to 44 ml per minute. Okay, and the moderate decrease in GFR with or without other evidence of kidney damage might be there. And in stage 4, the GFR decreases from 15 to 29 ml per minute. Okay, so it should be in between 15 to 29 per minute. And severe decrease in GFR with or without other evidence of kidney damage. If the stage is 5, then it means the GFR is below 15 ml per minute and established renal failure. It means now the person requires the disease is no more reversible and the person requires the renal replacement therapy. Okay, so what is chronic kidney disease? The CKD means kidneys are damaged. The nephrons are basically damaged and losing their ability to keep us healthy by filtering blood. In this early stages of the disease, most people do not have symptoms, but as kidney disease gets worse, waste can build up in the blood. And because of building of that wastage, what will happen? Because of building of that wastage, there will be it is going to affect the blood pressure of the patient. Okay, it is going to affect the cardiovascular health of the patient. Okay, so it may develop other problems like high blood pressure, anemia, weak bones, poor nutritional health, and nerve damage. And because kidneys are vital to so many of the body's function, kidney disease also increases the risk of having heart and blood vessel disease. Okay, so while these problems may happen slowly and without any symptoms, they can lead to kidney failure, which can appear without warning. Once kidneys fail, dialysis or a kidney transplant is needed to stay alive. And kidney failure is also called kidney failure with renal replacement therapy, that is KFRT. Okay, what are the different types of kidney diseases? What are the common diseases which are linked to the kidney? First is the polycystic kidney disease. It is a genetic disease, and the second is the hypertensive nephrosclerosis. Third is the glomerulonephritis. Then next is UTI or urinary tract infection. Generally, UTI is the disease or it is a common disease of urinary tract. But when this infection reaches up to the kidney, reaches up to the the nephrons, the kidneys, then it is going to be considered under this urinary tract infection. Okay. Then the diabetic kidney disease is one of the common kidney disease, and analgesic nephropathy is also one of the kidney disease. So what is polycystic kidney disease? Polycystic kidney disease is it is a genetically acquired kind of disease, and it has two forms. One is dominant form, another is recessive form of PKD, that is polycystic kidney disease, PCKD. In the dominant PKD form, one parent has the disease and passes it to the child. The chance of the passing the gene to the offspring is only 50%. It means if the parent is going to have 4 children, then 50% of that 4 means two children will be affected with this polycystic kidney disease, and other two will be healthy. Okay, so the chances of transferring this PKD will be it will be 50-50%. So cysts are abnormal pouches containing fluid. Eventually, the cyst replaces normal kidney tissue that is going to finally lead to the end stage renal diseases. Okay, so what are the signs and symptoms of this polycystic kidney disease? Okay, so the sign and symptoms of yeah, so sign and symptoms of this disease is it is going to cause dull pain. Okay, dull pain in the abdomen and back. Okay, and also the blood in the urine, frequent UTI or urinary tract infections. Okay, and also the yeah. Frequent UTI means the person will get infection in their urinary tract very frequently. High blood pressure, often before cysts appear, and upper abdominal discomfort that the liver and pancreatic cyst might be there in PKD. Okay. Then the second disease of the renal system is the hypertensive nephrosclerosis. It is poorly controlled high BP, or basically this hypertensive nephrosclerosis is because of the poor control of blood pressure. Okay, means high BP is not under control, is not and that high BP is damaging the kidney, and it can also lead to the kidney failure. And in this, the blood vessels get thickened. It gets the blood vessels is going to get injured. Okay, then glomerulonephritis. This glomerulonephritis is an inflammatory condition that affects predominantly the glomeruli, and the causes are the immunoglobulin A nephropathy, streptococcus bacteria, and autoimmune kind of diseases might be the cause of this glomerulonephritis. Okay, and glomerulosclerosis is the scarring of the glomerulus. So what are the signs and symptoms of these two diseases, these two abnormality of the renal system? One is there will be, if the person is having glomerulonephritis, then their urine is going to contain blood and protein. Okay, generally our urine do not contain protein and blood. Okay, but in case of glomerulonephritis, urine is going to have blood and protein. For the urine will become milky in appearance. It is going to give some kind of milky appearance. Dark or pink colored urine might be experienced by the patient. Leg swelling means the swelling of the lower limb. Systemic disease like diabetes or autoimmune diseases, which will have systemic manifestations. For example, weight loss, arthritis, or skin rashes will be there. Okay, then UTI, urinary tract infection, is one of the most common kind of infection in females. Okay, so it is a disease of the urinary tract, and infection occurs when any pathogen or microorganism attach themselves to the urethra and begins to multiply. Okay, and that may lead to the infection. If this UTI is not treated on time, then infection is going to get inside the kidneys, and that will damage the nephrons. Okay, and if that is also left untreated, then pyelonephritis and or the permanent kidney damage can be there. Okay, so especially women, the women population are more prone to this UTI as compared to male. Why? Because the length of the urethra is greater in males as compared to females. So males are not that much prone to this UTI. Okay. Then the conditions that increases the risk of this urinary tract infections are the diabetes. Okay, the situations where where urine catheter is needed, abnormalities of the urinary tract, obstructed urine outflow, and for example, large prostrate, or because of obstruction, means if there is any stone in the urinary tract, then that stone is going to block the passage of urine, so that will also cause UTI. Okay, and pregnancy is also one of the cause for the urinary tract infections. Then another disease of the kidney is the kidney stones. Okay, so start as salt or chemical crystals that precipitate out from urine, and this occurs when substances in urine that prevents crystallization are ineffective, and the salt and the crystals are the salt and the other substances are going to be accumulated, and they will form the stone like appearance. Okay, and that is going to block the passage, that is going to cause severe pain and also the infection and the backflow of the urine in the patient. Okay, so the various forms of kidney stones, the most common is calcium in combination with either oxalate or phosphate, and this kidney stone is this kind of disease or condition is more common in males as compared to females. So next disease of renal system is the diabetic kidney diseases. The common in chronic and poorly controlled diabetics, and diabetes damages blood vessels in the kidneys, and it occurs in both types of, whether it is type 1 or type 2 diabetes. In both the type of diabetes, this kidney failure, the kidney disease, diabetic kidney disease can be seen, and the occurrence of high BP in diabetics is a strongly predictor of chronic diabetic nephropathy. And this diabetic kidney disease is very much common, and it is one of the most common cause of end-stage renal disease in many developed countries. Then what are the symptoms of this diabetic kidney diseases? Frothy urine, okay, swelling of the lower limb or leg, and also when the person is going to walk or stand, this leg swelling case becomes worse. Okay, high BP, itching, vomiting and nausea, weight loss, lethargy, patient will feel all the time very tired and sick, increased need to urinate at night. Person will go for urination for at least 3 times, 4 times, even 5 to 6 times. Okay, so increased need to urinate at night increases in diabetic kidney disease. So how we can treat this DKD or diabetic kidney disease? It can only be treated by controlling the blood pressure. Okay, and by controlling the blood sugar level as well. So good control of diabetes means the HbA1c level should be under control. Glycemic control is very important to treat diabetic kidney disease. Okay, so good control of blood pressure aiming for less than 130 by 85 or lower in younger patients, and medications to decrease protein excretion and preserve the function of the kidneys. These are the treatment for the diabetic kidney diseases. Okay, and also the diabetic kidney disease patient should lower their protein diet, treat any urinary tract infection, which is common in diabetics. Then the next disease for the renal system is the analgesic nephropathy. Okay, so those people or those patients who are on painkiller for a longer duration or who are on analgesics for a longer duration, they develop CKD or they might develop some kind of nephropathy. Okay, so it is associated with the condition which require constant need for painkiller medications, and that may also lead to the end stage renal disease. Okay, acute kidney injury is also one of the common disease of our renal system. Okay, so the causes of acute renal failure is mentioned in this picture. See this picture clearly in this label one. This is the your renal artery. Okay, so what is happening here? This is the pre-renal area. Okay, before the kidney, this is pre-renal. Okay, and just at the in the kidney it will be intrarenal. Okay, and after the kidney this area will be post renal. Okay, so pre-renal, intrarenal and post renal are these are the three areas where the acute kidney injury can be uh, seen. So in pre-renal area means in this area the sudden and severe drop in blood pressure or interruption of blood flow to the kidneys from severe injury or illness or some kind of accident will lead to the pre-renal acute kidney injury. Okay, and intrarenal acute kidney injury might be because of direct damage to the kidneys. Okay, by infection inside the kidneys, by inflammation of the kidneys. Okay, because of some kind of drugs, toxins, or reduced blood supply to the kidney lead to the intrarenal acute kidney injury. Okay, and post-renal kidney injury is because of the sudden obstruction of the urinary flow, maybe a stone, maybe the blockage of by the stone at this site or at this site. Okay, this will lead to the post-renal acute kidney injury. Then, what is chronic kidney disease? The chronic kidney disease encompasses a spectrum of different pathophysiological processes, which is associated with abnormal kidney function and a progressive decline in GFR. So basically, in chronic kidney disease, if the the decline in GFR is not controlled, if after several attempts, after after if we after doing all the possible things, if GFR level or the decline in GFR is not controlled or it is not stopped, then that it progresses to the chronic kidney disease. Okay, so these are the stages of chronic kidney diseases. If the GFR is greater than 90 ml per minute or equal to 90 ml per minute, that is known as the stage 1 GFR, the stage 1 CKD. And stage 2 chronic kidney disease is in which the GFR will be 60 to 89 ml per minute. Okay, and in stage 3, the GFR decreases 30 to 59 ml per minute of the rate of the filtration decreases up to 30 to 59 ml per minute. Okay, and in stage 4, the in stage 4, the GFR or the glomerulofiltration rate decreases up to 15 to 29 ml per minute. And in stage 5, the GFR decreases or goes below 15 ml per minute. Okay, so it means normally our GFR level is 125 ml per minute. Okay, but when because of because of certain inflammation, glomerulonephritis, because of diabetes, hypertension, the GFR level goes start declining. Okay, and if that declining is not controlled on time, that will lead to the chronic kidney disease. Okay, chronic kidney diseases can be caused because of the diabetes mellitus. If the diabetes is not controlled, if the the glycemic control will not be there, if the HbA1c level will not be controlled, okay, that will lead to the that is going to affect our kidneys, and finally that will lead to the chronic kidney disease. Okay, and the next most common cause of CKD is the hypertension, and the third one is the glomerulonephritis. Okay, so together these causes approximately 75% of all adult cases. Okay, so in today's lecture, we have discussed about. Let me go back to your yes, to your first slide. So we have discussed about. We have talked about the introduction to the kidney functions of the kidneys. Like the kidney is going to have excretory function, homeostatic function, endocrine function. Okay, and kidney is balancing our acid-base balance, and it is it is performing lots of function like it is regulating the blood pressure. It is also controlling the vitamin D level, because kidney helps to activate the inactive form of vitamin D to the active form. Okay, so basically kidney activates vitamin D to so that it can be utilized by our body. Okay, so basically we can say that kidneys are helping our body to use vitamin D which is already available. Okay, we have also discussed about the symptoms of the diseases, and we have taken an idea. We have discussed a little bit about the chronic kidney disease. Okay, so in the next lecture, we'll be discussing about the unit second of your of your this BVDT 103. Oh, thank you.